Hello, welcome everyone. So I see that we have a lot of participants joining us. I'm just going to take some time to let everyone connect in with their cameras and with their audios. Wonderful.
Hello.
Hello, everyone. Good to hear some voices.
Good morning.
Good morning.
Morning.
Hello, morning.
Nice. Wonderful. So as we jump in and slowly let people in throughout this event, I just really want to welcome everyone to this Wellness Wednesday event. It's happening in October, already October now, and this event is organized by the BC Brain Wellness Program, and our topic for today is exercise and fall prevention. So I'm just going to share my screen so that we can have some slides up to assist our intro for today. So we have some amazing presenters today to discuss with us about exercise and fall prevention. And I want to go over that we are able to offer these healthy lifestyle programs at BC Brain Wellness on the traditional, ancestral, and unceded lands of the Musqueam peoples. This land is situated and has always been a place of learning for the Musqueam, who have passed on their culture, history, and traditions from one generation to the next. We hope that Wellness Wednesday is an opportunity to continue that tradition of sharing knowledge to the community at large. To introduce myself, I am the moderator for today. My name is Djavad Mowafaghian, and I have been a part of the BC Brain Wellness for a bit over a year. I am an exercise instructor and kinesiologist, where I teach the Balanced and Strengthened Step 1 class. This class occurs every Tuesdays and Thursdays from 11 a.m. to 12 p.m. And as a kinesiologist instructing these classes, I'm very excited to listen to these amazing experts. So we have Dr. Teresa Liu-Ambrose, who is a well-accomplished researcher exploring how to reduce risks of falls using exercise interventions. We are also joined by physiotherapist Naomi Casiro, as she guides us through how she uses fall prevention strategies and cognitive games in her practice and exercise programming. Finally, we will be using the remaining time to engage the audience in some questions and answer period. So we encourage you to share your questions and comments using the chat function in Zoom, and I will discuss those questions that you bring up to the speakers at the end of the session. So please note, we are recording this session. So at the moment, please mute yourself unless you are the presenters. And we will be uploading this recording onto YouTube account and our website under the resources page at BC Brain Wellness. Thank you so much. So we will first hear from Dr. Teresa Liu-Ambrose, who is a professor in the Department of Physical Therapy and Canada Research Chair in Physical Activity, Mobility, and Cognitive Health. She is the Research Director of the Vancouver General Hospital Falls Prevention Clinic and Director of the Aging, Mobility, and Cognitive Health Laboratory. Dr. Liu-Ambrose is known internationally for her work in randomized controlled trials of exercise with cognitive and mobility outcomes in older adults. Her research findings have been implemented in health authorities, translated into provincial-wide programs, and influenced international practice guidelines to promote healthy aging. So Dr. Liu-Ambrose, it's an honor to have you here. Thank you for joining us, and you may take it away. I will stop sharing my screen. Thank you.
Thanks, Gemma, and thanks everybody for taking the time to be here today. I'm just going to transition and bring up my slides. Yeah, so for the next 25 minutes, what I like to talk about is the evidence that exercise is a highly effective strategy for preventing falls. But I also like to nuance the story a little bit by talking about how cognition also plays a role. So as an overview, what I will do is first provide a very brief context, then I'll share the research we have done. I do think knowing the research is important because I think we all appreciate how beneficial exercise is, but sometimes it is hard to do. And I do think if we know the evidence, it'll give us more incentive to engage in it on a regular basis. Then I'd like to end the session just talking about some general resources that is available within both Vancouver and beyond in terms of falls prevention. So first, when it comes to falls, we actually know that it is a significant major healthcare issue. It's estimated that 1 in 3 older adults who live in their own homes will fall, and about 50% of them will fall frequently. Falls are significant in the sense that 95% of all hip fractures are due to a fall, and falls are associated with high morbidity and mortality. We also do know that falls are not accidents in the sense that we know what causes them. So we do know that when it comes to physical function, having poor muscle strength or poor balance does contribute to your risk of having a fall. But also we now recognize that your cognitive status also plays a significant contribution. So even mild changes in your cognition can increase your risk for falling and may be attributable to how quickly you can process information, develop an appropriate reaction to the event. So when it comes to preventing falls and modifying their risk factors, the evidence currently do suggest that exercise is a key component in preventing falls. We do know that exercise is highly beneficial for physical function. So, when you do exercise, you are stronger, you potentially can balance better, and you simply could be also more coordinated depending on the type of exercise training you engage in. We also have another body of literature that now also shows that exercise is highly beneficial for your cognitive function. So collectively, exercise may reduce falls by both promoting your physical function as well as your cognitive function. So as I already mentioned, exercise is viewed as an evidence-based approach for falls prevention, but we still have knowledge gaps. So when it comes to individuals who are at risk for falling. So these may be defined as individuals who previously had a fall, and because they've already had a fall, we know they're going to be at greater risk for having a subsequent falls, or those individuals who may have some changes in their cognition or have frank dementia. And so when it comes to the role of exercise in preventing falls within these higher risk individuals, that is not as well established, and that's something that my research program looks at. So now I'm going to segue to some specific research that we've done at UBC looking at the role of exercise in preventing falls in at-risk populations. So the first study I want to share is a randomized controlled trial. So these are studies where we recruit individuals, we assess them, then we basically by chance randomize them to different groups, and we look at how the different groups may vary as a function of the outcome of interest. So for this particular study, we recruited 344 older adults who all fell and actually ended up seeking medical attention for their fall. They either went to the emergency department or saw their general practitioner. And they were then referred to our Vancouver Falls Prevention Clinic for care, and we recruited them from the clinic to engage in this study. For those who did agree to participate in the study, they were randomized, so kind of like a flip of a coin. They were randomized either to receive a 12-month exercise program called the Otago exercise program, or continue to receive really good usual care provided by our geriatrician. And the primary focus of this particular study, again, is to look at the role of exercise in preventing subsequent falls in a rather high-risk population. So just to expand a little bit on the intervention itself, so it's called the Otago Exercise Program because it's a program that was initially developed by researchers from Otago, New Zealand. And it's been shown to be highly effective in reducing falls among otherwise cognitively healthy older adults. It's a home-based exercise program, which makes it highly feasible and to be delivered by a physical therapist. whereby the physical therapist makes 5 individual visits over a 6-month period. But between that, the individual or the patient should be essentially carrying out the exercise prescribed on their own approximately 3 times per week. The exercises included strength training as well as balance retraining. But the beauty of this exercise program is that it really is minimal equipment. So hopefully you can see from the slide here that some of the strength training simply is actually related to things such as sit to stand. So sitting in a chair and then standing up and then repeating it. And you actually end up working out your lower leg muscles quite a bit. Balance exercises can include walking in a figure-8 format within any area of your home, or holding on to your kitchen countertop while you practice single leg standing. Now, in addition to completing these specific strength and balance retraining exercises, everyone was also encouraged to walk at least twice a week for approximately 30 minutes. And they can break up that 30 minutes however they want to. It could be 2 bouts of 15 minutes or 3 bouts of 10 minutes, etc. Then for the other group of individuals, they receive what we call usual care, which may not sound too exciting or beneficial, but in fact, they were receiving continued care provided by a geriatrician. And for anyone who's ever tried to access specialized care provided by a geriatrician, it's a long wait time. So in essence, people in this study were still getting, I would say, above standard of care, even though they were randomized to what we call usual care. So the care provided geriatrician included anything from referral to other specialists, such as cardiologist or optometry, or adjustments of medication to reduce their risk for falls. In terms of our primary focus for this study, we wanted to know how frequently people fell after enrolling in this study. So falls were tracked over 12 months using monthly calendars. So we have these pre-printed calendars. And if someone did have a fall, they would indicate that they've had a fall and then mail the calendars back to us at the end of every month. In addition, we conducted a pretty comprehensive assessment of their physical performance. So some of these specific measures included a time up and go test or a short physical performance battery. But in summary, really, that these were simple clinical tests that we use often to assess one's mobility and how well people can balance, as well as their functional strength. And then we also conducted a comprehensive assessment of people's cognition using standard neuropsychological testing. So if you've ever gone to a memory clinic, you probably have experienced some of these neuropsychological tests. Now, just to share what our individuals look like. So again, we recruited 344 individuals, all with a history of falls. So this is this is their baseline description, meaning that at study entry, what did these 344 individuals look like? So first, I want to flag that on average, each of these individuals experienced at least 3 falls prior to enrolling in our study, which is fairly significant. But the other piece I also want to flag is that if you look at the Montreal Cognitive Assessment, which is a brief screening tool for cognition, again, on average, many of these people had some degree of cognitive impairment. So even though we weren't specifically recruiting people based on their cognitive status, but rather their fall status, by and large, many of these individuals had cognitive issues. And in terms of their physical abilities, what we can see from their gait speed, which is measured in meters per second, is that they are at risk for falls. And so gait speed is, again, just really about how fast you walk at your usual pace. But it's really been shown to be quite predictive of outcomes in older adults. And typically what we're looking for is a gait speed of 1.0 meters per second. And anything below that 1.0 meter per second mark can be indicative of individuals at risk for falls or for adverse outcomes, as indicated by this chart here. So again, here we have so I'm just going to use my little highlighter, hopefully laser pointer here. Here is that kind of magical mark of 1 meters per second. And what we can see is that based on research, we know that people who walk 1 or faster have less likelihood of being hospitalized, less likely to have adverse outcomes, versus those who walk slower than that. They tend to have additional risk factors for falls and adverse health outcomes. just need to get rid of that. And so then in terms of results, so what did we find? So we actually found the Otago exercise program was significant in reducing falls. So individuals who were randomized to the Otago exercise program actually experienced 36% fewer falls as compared to those who received usual care. But also quite interestingly, we noticed that, or what we found is that those in the Otago exercise program also improved their cognition, specifically within the domain of what we call executive functions. And we know executive functions are what are higher order cognitive abilities that really allow us to function independently. And so here what we're demonstrating is that a rather simple home-based exercise program not only could reduce one's risk of falls, but also promote their cognitive health. Surprisingly, we actually didn't see any effect of the exercise program on physical function in this cohort of individuals. And so here is just a graphical representation of the differences we saw in terms of number of falls across the two groups. So orange indicates those individuals who were in the usual group. Blue indicates those who are in the Otago exercise group, and basically the line indicates is really accumulation of falls observed over 12 months. And what we can see is over the 12-month period, those in the usual care group collectively experienced more falls as compared to the Otago exercise group. So in terms of our results, what is probably most interesting from the perspective of falls prevention and understanding's relationship to cognition is that here what we found is that the Otago exercise program reduced injurious falls by improving cognition. So we basically went ahead and did some fancy statistics to better understand, well, okay, exercise prevents fall, but how does it do it? Is it by improving cognition? Is it by improving your physical function? And here in this study, we actually found is because it improves cognition, thereby you see the reduction in falls, and not actually because it per se improves physical function. And so in terms of, what we take away from this is that we think for people who are already physically and cognitively frail, that very small gains in both physical functions and other relevant domains such as cognition can collectively contribute to falls reduction. And that when it comes to exercise and how it brings about its benefit to reducing falls, of course, we typically default to the fact that it may improve your muscle strength and improve your balance, but also could be that, it brings about benefits by improving your cognition and in particular, perhaps impact the neurosubstrates that contribute collectively to one's cognition, mobility, and falls. And I'm just going to talk about that a little bit moving forward from here. So when we think about falls and impaired cognition, we actually know that for many older adults, they often coexist. So for an individual who comes into our clinic who reports, I've had many falls and I can't seem to stop falling, very often if we assess their cognition, we will be able to detect some impairment as well. And the notion that as to why these both syndromes coexist is the fact that they also probably share similar pathologies. And so one shared pathology is what we call covert cerebral vascular disease, really a fancy term for saying very subtle changes in the brain vessels or in the blood vessels in your brain that feed your brain tissue. And so as we age and develop chronic conditions such as high blood pressure or type 2 diabetes or poor lipid profiles, what can happen is that the blood vessels in our brain are not as effective in delivering oxygen and nutrients to the brain tissues. And it doesn't have to happen at a very sort of frank, obvious level, but a very small level, whereby it's really the small vessels that tend to not work so well or become blocked, and therefore small areas of the brain basically suffer insult or ischemia or the lack of oxygen. And then on neuroimaging, what we can see is that there are these hyper-intensive signals that appear from the brain, and that's indicative of subtle damage to the brain. Although for the individual, they do not experience any frank symptoms such as one would experience if they actually had a stroke. We can also see larger infarcts such as lacunes, which is more fluid filled, but collectively both of these pathologies are typically clinically silent, but we also do know that they contribute to the risk of having impaired mobility, such as slowing of gait, the risk of falls, and the development of cognitive impairment and dementia. And then when you look at the risk factors, other than age, I hope you do recognize that, when it comes to high blood pressure, diabetes, especially type 2 diabetes, and poor lipid profiles, that exercise can actually moderate these risk factors very effectively. So in theory, should also moderate this particular disease course. And so here I'm going to just share some of that evidence. So we also have looked at different types of exercise training on the brain, and one of them is strength training or resistance training. So we conducted a 1-year study whereby we looked at the effect of resistance training in 155 older women who either received once a week of resistance training, twice a week of resistance training, or twice a week of balance and tone exercise, which really was a very gentle approach to exercise and not progressive at all over the 12-month period. And what we found is that strength training is actually very beneficial for your cognition in terms of improving your executive functions, but also can improve your brain function. So we acquired advanced neuroimaging from a subset of individuals from the trial. And what we saw is that not only did they perform a specific cognitive task better, but the brain was also recruiting more regions to allow better performance. But notably, when it comes to more the covert disease perspective, we also found that those who were engaged in the twice-a-week resistance training actually showed slower progression of pre-existing disease within the white matter. And that's actually never been previously shown previously. There's been a lot of drug trials trying to curtail the progression of such disease within the white matter, and generally not very effective. And yet we were able to show that by simply engaging in twice a week of strength training, that you could actually slow down the progression of pre-existing disease within the white matter. And as I mentioned previously, that these lesions not only contribute to your risk of developing cognitive impairment, but also your risk of developing mobility issues as well as falls. And so we looked at, what is the relationship between reduced disease progression within the white matter and one's gait? And what we found essentially is that by reducing disease progression within the white matter, we also saw a general maintenance of gait speed, meaning that people were able to maintain their mobility better across the 12-month period. And as you may recall, gait speed, as simple as it may sound, is really quite indicative of one's future morbidity and mortality. So in conclusion, exercise may positively impact your health by reducing falls and improving mobility, by improving your cognition actually and your brain health. So, for a multitude of reasons, you should engage in exercise both for your physical and for your cognitive health. Within the area of falls prevention, as we better understand the role of brain and cognition in one's risk of falls, there's lots of interest now in pairing cognitive training with exercise training to potentially increase the benefit of exercise on falls reduction. And also the notion of engaging in more cognitively challenging exercise per se, such as Tai Chi, whereby it's not really an intense exercise, but it is very mindful, and you're always thinking about the pattern of movement and the coordination of the movement. The other implication of what we're discovering regarding the role of cognition and the brain in terms of falls is that as we move forward in screening people for falls risk, we should really think about cognitive aspects as well. And then in terms of resources, there's actually quite a few resources. So first of all, I just want to flag that VGH, we do have a dedicated falls prevention clinic whereby for anyone who's referred to our clinic by their physician or physical therapist even, you would receive comprehensive care provided by a geriatrician, whereby we are aiming to reduce your overall risk of falls. And that can range anywhere from prescribing exercise or referrals to other specialists to, again, reduce multiple aspects of your falls risk. In terms of community-based programming, OsteoFit is a very popular program. It's a community-based exercise program that's offered in over 50 communities in BC. They have different levels, so you can enter the OsteoFit at a base level or more advanced classes, and each class include agility, balance, and strength exercises, and all instructors have specific training in regards to group exercise delivery for older adults with comorbidities. And we also have actually assessed OsteoFit as a program previously and have shown that it is an evidence-based approach for reducing falls risk while promoting your bone health. In terms of additional resource programs, there is also Steady Feet, which is offered by the Vancouver Coastal Health. It is modeled after the Otago exercise program, and you do need to be referred to it. Typically, Steady Feet is designed for those individuals who are at higher risk, so those who've already had a fall, or perhaps based on the physician's assessment that they are at significant risk for a future fall. And if you yourself want to learn more about how you can reduce your own risk of falls, the province of BC actually has very good resources online. So I've included the link there, which may not be super helpful in the sense you can't click on it, but if you just even Google government BC and falls prevention, you will find resources both for yourself, but also for health professionals. So key points is that falls are a significant healthcare problem, and that impaired physical and cognitive function are major determinants of falls risk. And really exercise is that kind of magic bullet that really tackles both domains quite effectively, and that there are resources available to educate yourself and strategies to reduce your risk, your own risk for falls in the future. And that's it. Thank you.
Thank you so much, Teresa. I really appreciate you sharing the knowledge about this with us. And now want to continue our exploration of exercise interventions and fall preventions with Naomi Casiro. I will just be sharing my screen one more time. Wonderful. So Naomi is a registered physiotherapist and founder of NeurofitBC. Naomi is an adjunct professor at the University of British Columbia, where she teaches about the treatment of Parkinson's disease through exercise and physiotherapy. Naomi founded NeurofitBC to allow her to better serve the Parkinson's population and as a platform on which to educate other health professionals. Naomi now spends her time teaching classes, treating clients, and offering courses to health professionals about the incredible impact of exercise and neuroplasticity on those living with Parkinson's disease. I know quite a few of our participants are part of the NeurofitBC, so I'm really happy for you to be joining us today. Welcome, Naomi.
Thank you very much. I'm going to share my screen here and see if we can get, hold on 1 second here. See if we can get this up and running. I know you guys have a very strange view of me, but that's because I'm going to be moving in and out of the camera as we try and do some practical here. So bear with me.
Sounds great.
Fabulous. Thank you guys so much for having me today. I have 20 minutes to attempt to accomplish a lot today. So we've got big goals for our 20 minutes today. What I'm going to try to do today.
I cannot see the screen. I cannot see the screen.
Oh, we're missing, somebody can't see the screen there. I'll let Matt help you out with that. Can everyone else, are we okay there, Gemma? Can you guys see it?
I believe we're okay. And thank you, Matt, for helping him out. Please continue. Thank you.
All right, so what are we going to try and accomplish today? So I'm going to try and help you guys leave with an understanding of how to evaluate the cause of your potential past or future falls, so why you might be at risk or falling. I want to give you some practical tools to help jumpstart your falls prevention program. I want you to leave feeling informed on the benefits of exercise for falls prevention, with which Dr. Liu-Ambrose did a fabulous job of already educating you on, so we might skim over that. And I want to motivate you to try and begin or continue a challenging functional exercise program, okay? So the falls conundrum is this. We know that, and I should preempt this whole talk of saying that my special expertise here is in Parkinson's. So I tend to kind of bias things towards Parkinson's. So you'll notice that a little bit in here, but I do think it's very applicable to most neuro and older populations. So What happens is, you know, in Parkinson's especially, there's a large amount of people who have a fall, and this is in the older populations as well. And what happens when you have a fall? Well, you get scared, right? People have increased fear and they have a reduced physical and psychological health associated with their fear of falling. And what happens when you're scared? You reduce your activity. So people tend to reduce their activity when they're afraid of falling, which reduces their quality of life and increases their falls and risk again. So we just end up in this downward spiral, right? Once people are at high risk or have had a fall. So what we're trying to do is kind of break this cycle and reduce your risk of falling to help you get more active, to reduce your falls overall. So there's a few things that can contribute to this kind of falls conundrum. The one that we're going to really focus on today is functional exercise. And as you saw, there's a lot of substantial evidence showing that regular exercise is super important in maintaining all these different facets, which can help to reduce your falls. So what about those of you who are not falling yet? Maybe you're having near misses. So that's when you kind of stumble and don't go down, or you're grabbing onto the walls. Maybe you're doing some furniture surfing, right? Where thank goodness you've got those dressers around your room, or otherwise you may have had a fall. That's great that you're not falling yet, but prevention is key, right? Let's not wait until you have a fall or have an injury. We need to get you moving and prevent falls as early as possible. So I'm going to take you guys through a little bit of how we assess falls in the clinic, what we do every time somebody comes in who has had a fall, and see if we can kind of apply this to you guys at home. So the first thing we do for these people who come in with a fall is create a falls portfolio or a near misses portfolio, right? If you're having those as well. So the first questions we ask are, how are you falling? Which direction do you fall in? Sometimes people don't think about this when they're thinking about their falls. It's really important, right? Are you falling backwards every single time you fall? Are you falling forwards every single time you fall? Do you only fall when you turn? Do you fall when you get up from a chair? How are you actually falling? That information is super helpful to help us do specific training to help you mitigate your falls risk. So are you getting dizzy when you stand up and that's when you fall, right? If you're lying down on the ground and then you stand up and you take a step, is that usually when you're tipping over or starting to see stars? Do you have Parkinson's and have freezing of gait where your feet feel like they get stuck to the floor? And is that why you fall? Does your foot catch, right? When you go to step up over a curb, or, you know, there's a tiny little ridge in the floor, do you catch your foot on that? And that's what causes your falls. We really need to think about how you're falling in order to best treat it. The second question we ask is, when are you falling? So are your medications managed? Are you falling when your medications are wearing off? Are you falling at the end of the day when you're really tired? Maybe you never fall in the morning, but by the end of the day, your falls risk suddenly seems to increase a lot, right? Are you falling when you're dual tasking? So this is a big piece of where the cognition comes in as well. Can you walk really well, but then suddenly when you have to carry a cup or a tray or somebody calls your name and you turn your head, that's when you're tipping over. And the last big question we ask is, where are you falling? So cats, carpets, couches, and corners are what we list as some of the major risk factors indoors, and outdoors are groups, gait aids, and gradients. So where are you actually having your falls, right? Is it both of those scenarios? Is there a specific picture that you can put together of where your falls are actually happening? By pinpointing a lot of this information, we can really better treat how to actually help you manage your falls risk. All right. So we're going to go through each of these. We're going to try and do a little bit of exercise associated with each of these and give you some information on how to manage them. So I can't give you every example, obviously, in 20 minutes. The original of this talk is about an hour and a half long, so we're going to try and keep it short and sweet. So for backwards falling, right? This is a very common one in Parkinson's, and this is, we're going to try and do this application for forwards falling as well. We call this retropulsion. It's when you kind of tumble backwards and either the wall stops you or the floor stops you or a chair stops you, but you don't manage to stop yourself. And it's a huge cause of falls. So what's the exercise-based treatment for retropulsive falls? So we are going to get up and start doing some exercises together. I promise I'm not going to make you guys start doing backwards rolling today. We'll do that another time, but let's all get up together. I'm going to step back a little bit here and we are going to start doing some very basics for retropulsive falling. Okay, so we're going to work on our foot floor connection and backwards reactive stepping. Now, I haven't assessed any of you. There is a lot of you on this presentation, so I'm going to do my best to keep you all safe, but I am relying on you at home to make sure you are setting up your environment safely. What does that mean? If you are doing this and you are at risk of falls, which is very possible given that you're listening to this talk, please put yourself in a corner. So find a corner of your room where you can see me, put yourself in a corner where you are safe and there are walls behind you and maybe a gate aid in front of you or a chair in front of you. Set up your environment so that you are safe, so that you can safely do this exercise, okay? So give everyone a second to organize yourselves. If you need a chair behind you or a chair in front of you, whatever you need to feel safe and confident, please do that, okay? But make sure you are supported. Again, ideal is to have a corner behind me. So the wall would be right behind me. So if I tip sideways, I hit the wall. If I tip to the other side, I hit the wall. If I tip backwards, I also hit the wall. All right. So what we're going to practice here is starting to get our weight centered over our feet, right? There's 3 really important points in our foot, and I'm going to show you the bottom of my dirty foot to prove this to you. Okay. We're going to focus on the pad underneath your big toe, the pad underneath your pinky toe, and the pad underneath your heel. You can see all those nice dark marks where I've been walking on the floor, right? So we're going to stand up with your feet shoulder width apart. You're going to spread your toes as wide as you can. And we're going to start trying to move our body from our ankles only. So what this means is your upper body is going to stay nice and stable, and I'm not going to bend at the hips. And all I'm going to do is start to try and teach myself how much leeway I have to go forwards, how much leeway I have to go backwards, how much leeway I have to go one side and the other side. Okay, so we're all going to stand feet shoulder width apart. You're going to tuck your belly in. You're going to lean forwards a little bit until you'll feel your toes start to curl. You can see my body is angling just a little bit, but I'm not bending my knees and I'm not bending my hips. Then I'm going to go backwards until my toes just start to lift off the ground. Okay, then I'm going to shift all my weight to one side and all my weight to the other. Okay, this is a really simple exercise, but very important in starting to bring awareness to where you are standing over your feet, right? If you are constantly sitting back on your heels like this, you can see that I don't have a lot of leeway before I start to tip. If we can rearrange your center of mass so you are centered over your feet, well, now you've got a lot more wiggle room in either direction, okay? Step number 1. So this is something you can practice every day. You're standing in the grocery store in the lineup, tip forward a little bit, tip back a little bit, tip to one side, tip to the other side. Try not to bend your hips and try not to bend your knees, okay? We call this ankle strategy. So exercise number 1 for retropulsive falling. If you're falling forwards, this is a great one as well because it teaches you how far you can go forwards before you need to step. We're going to practice some reactive stepping now. So what we're going to do is we're going to learn to step backwards and to step forwards, and then we're going to try and make it a little bit more challenging. So when you step backwards, the second my shoulders go behind my heel, I am at very high risk of falling. Okay, so watch that again. If my shoulders go behind my heel, that's where I start to tumble and tip, right? So what we're going to do is try and step backwards, okay, without letting our shoulders go behind our heel. So you can see there's a nice line. My shoulders are forward and my heel is back. So all I'm going to do, maybe you've got your walker, maybe you've got chairs beside you, etc., is step back and step together. My heel is going back, my shoulders are staying forwards. This is going to give me a lot more control over my stepping patterns and put me at a much lower risk of falling than if I do this. Okay, so the second way you can go backwards, this is the trickier one, so make sure you've got things to hold on to if you need them, is we're going to step back and we're going to sit our bum back and bring our shoulders forwards. You should feel a nice stretch in your hamstring, the back of your leg, and then you're going to come up and go to the other side. Okay, we're going to sit back, stretch through the hamstring and come back up. So again, we're learning to distribute our weight backwards in a safe way so that if you are to be nudged backwards, instead of tipping like this, we're starting to try and teach you to step. And that's going to make you much more stable in your backward stepping. Okay, same thing can go for forwards, right? I need to learn to actually move my foot so my shoulders stay behind my leg in this position. So same thing goes for forward stepping, right? If my shoulders get forward over my toes, I'm going to get into that. All right. So backwards and forwards falls training. Now that's step 1 of a whole treatment program. Normally we would teach you all the other components of that, but we can't today because we're going to run out of time. So that's one example. Okay. We're going to share my screen again and we're going to go back to our next examples. Okay. So some of the other ways that we would teach this is to start teaching people how to actually fall backwards. One of the things we know is that if we can teach you how to fall properly, we can increase your confidence and therefore reduce your fear and therefore reduce your falls risk. So we always teach people how to fall in our clinic, but we don't all have padded floors at home, and I happen to test all of you, so we're not going to do that today. Okay. So remember, ankle strategy, forwards and backwards stepping. Number 2, people can get orthostatic hypotension. That means when you sit down and you stand up, you get kind of dizzy and your blood pressure is probably dropping. Okay, so I'm going to teach you a super simple way to help mitigate that. Okay, we're all going to sit down on a couch or a chair or something. Okay, I'm going to use my handy chair here. And we're going to do 1.5 minutes of exercise to help you manage your orthostatic hypotension if you have it and reduce your falls risk. If you ever get dizzy when you are standing up from the floor or from a chair or from bed, this is what you're going to do to help manage that. Always get assessed by your doctor too. That's a great starting point. Okay, so we're going to pump our heels. Okay, all you're going to do is lift your heels up and down. Okay, we're going to do 10 of them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you're going to kick your legs out in front of you. Okay, kick your legs out in front of you. Keep your trunk nice and tall. Get that blood moving. We're going to go 10 of them. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Okay, we're going to march our legs up and down for 10. So march those legs up and down for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Last one, you're going to put your foot out, point and flex your toe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Other side, same thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you're going to stand up and do the most important part of this whole thing, which is count to 5. So you're going to stand up, and before you move, you're going to go 5, 4, 3, 2, 1. This is so important because what it's going to do is give you a moment to recognize if you're starting to get dizzy. If I stand up and my chair is right behind me and I start to get dizzy, I have a much higher chance of being able to sit back down and recover before I fall. What often happens, what we see a lot clinically, is people stand up, they take 2 steps, suddenly now they're dizzy and all their supports are gone. Okay, so those are some tricks and tips for you if you feel dizzy when you go to standing to manage your orthostatic hypotension. Okay, next up, guys, we are going to go to freezing of gait. Okay, so anyone who has that feeling where your feet get stuck to the floor, we're going to practice some exercises that are going to help you, help assist you with that. And these are also going to work for anyone who has toe catching. Okay, so things where you notice that your foot is catching on the floor and it's not getting up and through in your gait as much as it should. Okay, so we're going to all stand up together. Again, please make sure you are safe in your environment. You're going to hear me say that about 100 times today. Okay, so freezing of gait. You're walking, you get stuck, okay? Or you're walking and you start to feel your toe catching. What's the first thing we're going to do? We're going to stop moving, okay? If you feel like you're tumbling forward, often what people really want to do is just keep stepping. It's the opposite of what's going to help you stop your fall. Stop moving, okay? Second thing we're going to do, this goes for toe catchers too. Stand up tall. So shift your weight and find the center balance in those feet like we talked about at the beginning. Okay, next up, you're going to shift your weight. You can see why we did that first exercise now, right? You need to be able to find your center and then you need to be able to shift your weight. Next thing we're going to do is we're going to take a big step and you're going to lead with your heel when you land. Okay, everyone see that position? So I'm going to take a big step forward like I'm stepping over a big hurdle and I'm going to land with my heel and my toes up. Okay, let's do that again. Stop. Stand tall. Shift your weight side to side and then start to lift and step and lift and step. Okay, this is going to help unfreeze you. And for anyone who's getting that toe catching, practicing that lifting and heel strike is going to help free your foot from the floor and allow you to start amplifying those patterns. Okay, if you are getting heel catches on the floor or toe catches on the floor, sorry, this is a great way to practice stepping, right? It looks ridiculous and it works. So I always say to people, if you don't look silly, you're probably not doing these exercises right. Lift and step over. Okay, lift and step over. So this is a great way to practice walking, to start teaching your body to amplify those systems and practice your balance. Okay, here we go, guys. I know, back and forth, right? Next up, So when are you falling? So for medication management, we're going to leave that to the docs. If you're not sure, you should talk to your doctor if your medications are wearing off when you're falling at the end of your medications. If you're falling at the end of the day because you're tired, start planning your activities around your fatigue schedule. Okay, so if you know that morning is your best time, that's when you want to get all your activities and plan your exercise for the late morning, plan your visits with your friends in the mornings. Try and shift more of your activities to the times when you know you're going to be less fatigued, so that you have a little bit more leeway to rest and recover in those times when you know you're going to be tired and maybe have a bit of a higher falls risk. Dual tasking. We're going to practice this one in just a second. Okay. We want to train that brain. So we're going to practice a few cognitive dual tasking training type exercises. Okay, that can help you to start to learn to move your legs underneath you while your brain is busy doing other things. Okay, one of the things that we see practiced a lot in balance is this. Okay, this is not a position that we generally do functionally a lot in life, right? So my argument is always, let's train the function. In life, what are we doing? We're walking, we're talking, we're turning our heads, we're trying not to walk on a tightrope, right? So let's train those type of things. So what we're going to do now is you're going to bring, you're going to have something behind you. You can do this without a chair if you want, but if you need a chair behind you, you're going to use it. And we are going to practice some dual tasking activities, okay? We're going to have a little fun with it. So chair behind you, or if you can do squats without the chair, then you don't need it. We're going to try and do a squat or a sit if you need to. Sitting your bum back, touching your bum to the chair, and standing back up. When you're doing this exercise, you want to keep your trunk nice and tall. You want to sit your bottom back, and you want to drive the weight through your heels to stand back up. When we get to stand, remember that first activity we did of keeping our weight centered? We're going to try and find that center when we stand. So when you stand up, I don't want you coming here and feeling your toes curl, okay? Don't want you coming here onto your heels. Find that center. Those 3 spots on the bottom of your foot should be nice and connected to the floor. So we're going to do sit to stands, okay? You're going to do 10 of them with me. So all together, squatting or sitting. 1, 2, 3. You guys didn't think you were getting away without working out today, did you? 4, 5, 6, 7, 8, 9, 10. Now I'm going to give you a challenge, okay? When you stand up, you're going to name an animal. Okay, I am going to give you an example, and then I'm going to zip my mouth because it's very confusing to do if I'm yelling out animals at you at the same time. Okay, so what you're going to do is you're going to sit down. When you stand up, you're going to name an animal. So I'm going to say alligator. Okay, when I'm going to stand up the next time, I'm going to name another animal. I'm going to say bear. You notice there's a pattern there, right? Then cat, then dog. So what I'm doing is I'm working my way through the alphabet from A to Z, naming animals as I stand. Your goal is this: do not slow down your sit to stand or your squat because you are naming the animals. So I want you to try and move quickly and make your brain keep up, okay? I'm going to count the numbers for you. You guys are going to start squatting and naming animals. Here we go. All together. Ready, set, and go. So sit, stand up, name an animal with A. Then B, keep going. I'm going to count to 10 for you guys. See if you can get animals the whole time. You should be yelling them out. Everyone in your house should be able to hear you naming those animals as you sit to stand. Okay, try and keep your speed up as your brain has to work. That's it. Good work, guys. Good work. Okay, rest. So maybe you only get 3 sit to stands, and that's okay. Maybe you get 20 sit to stands. That's all right. This is something that you can continue to work on and build up. Maybe you need a handhold to get up. That's just fine, right? Work at your level. I'm going to give you one more exercise here, okay? I'm trying to be cognizant of time. One more exercise here. So now what we're going to do is we're going to try and combine sitting to standing and that stepping exercise that we did, okay? Remember, we don't just sit to stand in life. You're usually trying to go do something in the world, right? So what we're going to try and do, again, use your walker or gait aids if you need it, use walls if you need them, please be safe. You're going to sit down, you're going to stand up, and you're going to take a step forward. Okay, so let's try that all together. Sit down or squat down if you can't touch all the way. Step forward to one side. Notice I am not stepping on a tightrope. Okay, please don't step on a tightrope. We don't want you doing that in real life, right? Step to the side so you've got about a balance beam space in between your legs. If you need to do a small step to start, that's just fine. Okay. And then as you get more used to it, you can start going bigger. So let's do a few of those. You're going to squat down, up and forward, squat down, up and forward. Okay. Very nice. Now what we're going to do is we're going to add our cognitive task to it. Okay. So you're going to sit down, you're going to stand up, you're going to step forward, and you're going to name a flower. Okay, a type of flower. You don't have to go through the alphabet this time because I don't know that many flowers. Okay, so you're going to sit down, you're going to stand up, you're going to say rose, you're going to sit down, stay up, you're going to say lily. Okay, can't use those ones now. Here we go. Ready, set, and go. Sit, stand, step, and name a flower. Come back. Try it again. Okay, do your best. If you can't do the full version, that's okay, right? Participation, not perfection. That's our goal. We want you moving and challenging your body. Few more, see if you can get 3 more in here, guys. That's it. Squat up and step. Very nice. Good work. And rest. All right, guys, good. Take a breather for a second. We're gonna do one more exercise. Okay, last one for now, I promise. Have things nearby you because this is gonna be more wobbly than you probably originally think. So if you have a chair, have it beside you. If you have a wall, have it beside you. We're going to practice some head turning. So I have lots of clients who come in and they can walk beautifully. And then the second I call their name and make them turn their head, they start to tip and tumble, right? How many times when you're walking, does somebody call your name or you hear something behind you and you have to turn? It's just a very important life task that we need to work on. So instead of doing things statically, we're going to move. We're going to march. Okay. Your knees up and down. You're going to keep marching. Try not to stop moving your legs. And I'm going to call out directions for you, left, right, up, or down. And that's the way you're going to look. So you're going to turn your whole head one way, turn it the other way, look up or look down. Again, please be cautious. If you need to hold on to things, please do. If you need something behind you for safety, please use it. Okay, so let's go those knees marching. If you want to do a really hard version of this, you can run. Okay, we'll give you the option in case you want it. Otherwise, keep marching. Here we go. Fast as you can. Get those legs moving. Don't let them slow down. Left, right, right, left. All right, we're going to get harder. Here we go. Up, down, right, right. Got you there, didn't I? Left, right, down, up. Have your legs slowed down. If your legs have slowed down, pick up the pace, keep them moving a little quicker. All right, here we go. Right, right, up, down, right, left, and rest. Good work, guys. So functional training, right? We're trying to train skills that you use day to day so that when somebody calls your name on the street, you've practiced it, you can turn your head and you can continue to walk in a safe manner. All right? Let me get my screen back for you guys. Okay, so where are you falling, right? We talked about your falls portfolio and where you're falling. So this is a matter of arranging your home accordingly, right? And practicing. So for example, I'm going to show you guys a video in a second, but if you have carpets and you're constantly tripping on the carpets, can we get rid of the carpets, right? If you're somebody who has freezing of gait and you trip or you fall and you freeze every time you go around a corner, can you put something visual on the floor like a piece of tape in that corner that you can step over that will help reduce your freezing in that spot? It's a really good one for freezing of gait at home. Outdoors, do you get really nervous in groups and feel like you're going to fall in a group? What can we do about that? Okay, and my answer is train it. Now, makes everyone nervous these days. This is pre-COVID, just to be clear. Hence no one wearing masks and everyone in a big room running and breathing together, okay? So this is a video of some of the falls training we did in the clinic to train group activity. It looks like mayhem, but actually what's happening is everyone has a partner. They're going to opposite side of the rooms and then meeting their partner in the middle, doing a high intensity reciprocal task where they're tapping feet. And then they have to go touch a different cone on either side, just so you guys know what's going on, okay? I'm gonna play you this video. I don't know if you guys can hear the sound on it. Maybe not. There's music in the background, but I think it cuts it out. Okay, so there's loud blasting music. They're in a crowd. They have to move around everybody, right? And then they have to find their partner. They have to remember what they're doing. All those fun cognitive tasks involved in it, right? They're also tasked with not stepping on the cones. They're trying to avoid the obstacles as well, okay? If something is challenging, we need to train it, right? Use it or lose it. If we're not training those tasks, we cannot expect you to get better at them, right? So really good way to train group challenges, freezing of gait, and all those other things that can be tricky when you're moving around in a large group of people or with a lot of stuff around you, all right? So, like I said, fear of falling, we know leads to reduction in activity and increased risk of falls. One of the things that we really harp on in our clinic is teaching people how to fall with confidence, right? Not only is it going to help if you do go down, because we can teach you how to get up off the ground all we want, but if you get down to the ground and you fractured a hip, it's not going to do us any good, right? So learning how to fall with confidence is important. And then it helps reduce your risk of falls in the first place because now you're more confident and willing to be more active, all right? If you want to learn how to fall properly, please contact a health professional in your area so they can help you do this. It's very valuable, but it's not something you want to be training at home on your own without any guidance, all right? Take homes, get assessed, build a falls portfolio, right? If you are having trouble with falls, look at how those falls are happening and when they're happening and why they're happening. Okay, figure out what we're specifically trying to train so that you can choose exercises that build around it, right? Functional exercise is really important. So think about the challenges that you're having in life and how we can challenge you through exercise to improve those different specific scenarios, right? We know that cognition is important and that dual tasking is important because we do it every day and you have to be really good at it in order for your feet to keep moving underneath you while you do it, right? The earlier you start, the better. So get going as soon as you can, right? Some exercises always better than no exercise. So something is always better than nothing. Get out, get moving. If you are not falling yet, that's the time to start, okay? As early as you can, the better outcomes we're gonna have. All right, so there's some free resources here. Oh, sorry guys, there we go. There's a free resource at the bottom. I have a bunch of free online videos. There's no catch, just go and look at them. They help to they do follow along workouts for you at home. So if you want some exercises that you can do at home, following along with me on the video, those are there for you to use. Okay, Dr. Liu-Ambrose showed some fabulous resources in the community that you can use, and you can always go look up, like I said, a health professional in your area as well to help you get on track with that specific exercise so that we can help reduce your specific falls. Thank you guys so much for having me. I am happy to answer any questions, and thank you for exercising with me today. We always got to keep our bodies moving and try and do it practically if we're going to learn how to exercise right.
Thank you so much, Naomi. It always feels really good to move my body. So thank you for getting us to move our bodies today. So I invite Teresa to put your video on as well. And we just have a couple of minutes left. So we'll try to get through a couple of questions that were sent to us. Basically, thank you both so much for this conversation and these presentations. And I think Teresa really highlighted the benefit of exercise for reducing falls, as well as the benefit of resistance and strength training to prevent cognitive decline. And then Naomi, you really took into the exercises on how to do these exercises properly and beneficially. So there was one question asking specifically about sort of when and like how to incorporate these strategies into your daily life. Does someone have to take 30 minutes out of their day to train their balance and strength to get these benefits, or can a small amount go a long way? I'm first going to pass it on to Teresa, and then I'll pass it on to Naomi if that's all right.
Yeah, no, that's a very common question. So really the notion of dose. So I really think it depends on who you are. So I think Naomi kind of, already flagged that something is better than nothing. So I would say, if you are someone who's fairly inactive right now, little bouts throughout the day would be great. We know actually from evidence when it comes to exercise, it doesn't always have to be done in the continuous manner that we traditionally think about exercise sessions where, it has to be 30 minutes, has to be 40 minutes. There is that, term now, exercise snacks, whereby even just going up the stairs quickly, that's your exercise snack every hour, really could have huge benefits for your physical health. So I think the principle is, kind of know where you are, whether that's working with a physical therapist or a healthcare professional that kind of gives you a baseline, and then slowly add components to your exercise programming. The key point is to start and then to be consistent with it. And usually what happens is that when people do have a positive experience and feel successful, then that fuels additional efforts and incorporation into an active lifestyle. So there is no hard rule about how much, but rather start and then continue with the habit.
Wonderful. And the question as well was specifically asking about resistance training. Is that relatively true for the resistance strengthening as well in your research?
Yeah, if anything, what I like to add is that, if we tend to start targeting the larger muscle groups to begin with. And the reason being is that when we think about why we do resistance training, one is to promote or to prevent the loss of muscle strength and mass due to aging. And also we want to ensure that we promote bone health as well. So large muscle groups are good ways to start. So that includes things like such as sit to stand. You're going to be working your glutes, your and your quads, etc. And when you build muscle mass, it also helps you improve your cardiometabolic health. So in terms of your, lipid or sugar glucose levels, this is where resistance training really has been shown to be highly beneficial. Your muscles is a highly metabolic organs. And so the more you have of muscles, the better you can really regulate your metabolism, but also your overall metabolic health. So whether that's doing some in the morning and then doing additional components later on the day is fine. There's no evidence to say that you have to do one after another to sustain gains. And the other piece is that I think resistance training is really great option for people with limited mobility, because again, you can be done sort of with a chair or seated, and you can progress. So often, even with the sit to stand, we even say get a backpack, put a few books in there and increase the load that way. So you're progressing, but you're not getting into fancy equipment.
That's wonderful. Thank you so much. And Naomi, feel free to add anything onto that. There was another question directed to you as well.
I would echo what Teresa said. And, I would just say,
wonderful.
make it a routine, right? Start at 10 minutes in the morning and build from there, right? The more you can make it routine, like she said, consistency is key. We can tell you to work out for 2 hours and you're going to do it once and then you're going to stop, right? Do it consistently for a little bit of time and you're going to get much more benefit than trying to do it for 1 hour, 1 week, and then leaving it for a month, right? So 10 minutes a day to start and try and make it consistent routine.
Wonderful. And that follow-up question for you, Naomi, was if you could summarize so you were adding like cognitive tasks into exercise. Could you summarize what the benefit of that could be? Because we heard from Teresa that the physical activity improved cognitive functioning. So what's the sort of theory behind adding in those cognitive gains as well?
Yeah, so we know exactly from her lecture that, doing the exercise alone is going to help improve cognitive function. But what we need to do in our daily lives is dual task, right? We have to train our bodies to multitask throughout the day. And that is very often where we start to see people falling, right? They can function on a very linear, focused state where they're walking straight and there's no obstacles and no one's calling them and nothing and everything like that. But from a functional perspective, we have to start adding in that dual tasking, especially in Parkinson's. We know it's a really, really significant cause of falls, and we have to train it. We know from the research that we can train this. People get better at dual tasking the more they do it. So by adding it into the exercise, not only are we trying to build people's cognition overall, but we're trying to increase their functional capacity to dual task in their daily life.
Perfect. Thank you so much for both of you for going over these presentations and these questions as well. Just for the last 30 seconds of this talk today, I wanted to highlight some of the exercise and dance and yoga classes that we offer at BC Brain Wellness. So as you can see, there's a whole list of programs that we have. If you visit the BC Brain Wellness website or email us, we are happy to get any of the participants involved. And we're really trying to bring in all this amazing research and expertise that these two speakers have. So thank you so much for the two of you for joining us today. And I'll leave us for the rest of the afternoon. So thank you as well for the participants for joining us too.